Well, we understand people living and working in the area are understandably going to have concerns about the smoke, and it's important that people are aware what they need to look out for. Smoke can irritate the lining of the nose, throat and lungs, as well as the skin and eyes. So the sorts of symptoms people might see if they're exposed to smoke may include a runny nose and eyes, coughing, wheezing, breathing difficulties or chest pains. Anyone may be affected by exposure to smoke, but there are certain groups that are more likely to experience effects when they're exposed, and these would include people with existing breathing problems or heart and lung conditions, as well as groups such as the very young or old, smokers or people with flu or flu-like illnesses. Generally, we'd expect that symptoms would resolve fairly rapidly once exposure stops. So the first and most important thing to do is to remove yourself from the smoky environment. So if you're living or working in an area that's affected by the smoke, go inside, stay inside as far as reasonably possible. Close all your windows and doors and listen to advice on the local radio station or check Kent Fire and Rescue Service website for updates. And if you're somebody who suffers from asthma, make sure you carry your inhaler with you when you're out and about. If you find that symptoms are persisting or you've got an existing medical condition which you feel is worsening, then speak with NHS 111 or your GP and do let them know that you live or work in an area that has been affected by the smoke. In any large fire like this one, Public Health England, the Environment Agency and the Fire and Rescue Service will assess what is known about the situation to decide if air quality monitoring is needed or not. And the sorts of things that might be taken into consideration would include the nature of the fire, the weather conditions and how close the smoke plume is to the ground. In this situation, the assessment was that air quality monitoring was not needed and people should follow existing public health advice. The agencies are remaining in regular contact and should the situation change, our advice will be updated.